nutrition management of COVID-19 symptoms. Mild symptoms including coughing, lack of appetite, early satiety, and fatigue can be managed by taking warm fluids regularly throughout the day. It can also be managed by eating small, frequent meals rich in nutrients. Eating preferred nutritious meals or snacks, increasing the intake of fruits, seeds, and nuts, in addition to a healthy diet. However, if one is undernourished, overweight, or obese, or unable to eat as a result of disease, its symptoms or other existing comorbidities, they are advised to seek health care from a healthcare provider for more specialized and individualized nutrition and dietetics care. We have spent quite a bit of time talking about diet and the need for a healthy diet, and that is because of its importance and one of the ways in which we can defend ourselves against any infection is to ensure that we are eating right and eating the right food. Let me move now to today's update on COVID-19 statistics. Today we report 788 people who have tested positive following the testing of 5,521 samples. This now brings the number of positive cases to this brings the number of positive cases pushing our cumulative tests to 295,280. That's the number of cumulative tests we have conducted so far. Amongst these 788 cases of today, 785 are Kenyans, while 3 are foreigners. 475 are male, 313 are female. The youngest is 1 year old, while the oldest is 89 years old. The counties that have registered the largest number of positives, led by Nairobi County with 487 cases, Kiambu 86, Nakuru 34, Kajiado 26, Mombasa 25, Machakos 21, Busia 20, Narok 14, Bomet 9, and several other counties in single digit, which you'll find in the brief when you receive it. The cases in terms of sub-counties are distributed as follows, and I will read out for the first 2 or 3 counties that recorded the largest numbers. Nairobi, with 487 cases, had 58 cases in Langata, 50 in Westlands, 42 in Dagoretti North, 39 in Embakasi East, 34 in Makadara, 32 Embakasi South, 32 Starehe, 30 in Embakasi West, 29 Roysambu, 28 in Kasarani, 19 in Ruaraka, 19 in Kibra, 19 in Dagoretti South, 18 in Embakasi North, 14 in Embakasi Central, 14 in Kamkunji, and 10 in Mathare. Kiambu's 86 cases came from Thika, 19, Ruiru 13, Kiambaa 13, Kiambu Town 10, Kikuyu 8, Juja 7, Lari, Limuru, and Kabete 4 cases each, Gatundu North and Githunguri 2 cases each. Nakuru's 34 cases come from Naivasha, 21, Nakuru West 12, and Nakuru East 1. I think the rest I will allow you to read it from the document once we present it to you. On a positive note, 100 patients have recovered from the disease. From this number, 8 are from the home-based care program, and 92 have been discharged from various health facilities, bringing the total number of recoveries to 8,121. And again, we want to take this opportunity to thank our healthcare workers for the great work they're doing out there. At the same time, and unfortunately, we report also the loss of 14 Kenyans who have succumbed to this disease, bringing the total number of fatalities to 235. And we want to take this opportunity to send our deep-felt condolences to the families and friends of those who have lost their loved ones over the last 24 hours and over the course of this pandemic in the country. I'll stop there, and I want to thank you. And I want to now invite CS Macharia to make a statement that he wishes to share. CS Macharia.
Thank you very much, CS. I'm here to give an update on the transportation sector. Like you recall, we said before, this is a very, very key sector, both in terms of transmission of the virus, but also in terms of now opening up the economy. And so we thought it's important to update Kenyans as to where we are with regard to this particular key sector. I think you recall there were 3 areas we looked at before. The first one was the overland transport in terms of buses, which, if you recall, we managed to open up around the 6th of July this year. Then there was the issue about domestic flights, which, after getting approvals by the president and after doing the necessary protocols, we managed to open up the domestic flights on the 15th of this month of July. And then there was Madaraka Express, which, as you recall, connects Nairobi to Mombasa. And this was reopened on the 20th of July this year. So what has been remaining until now has been the international flights, which many of us Kenyans, many of the international visitors have been looking forward to this. You recall when the president did announce, he did say that domestic flights will be reopened on the 15th of July, but the international flights would wait until the 1st of August, which is 2 days from now. We decided to start with the domestic flights to give ourselves some learning curve so that we learn what needs to be done, see how many flights are getting to Nairobi or Mombasa or Kisumu or Eldoret, and then we shall take the appropriate measures. Before I conclude, let me say, these measures we are taking today, or these announcements we are making today, in terms of opening up the international airspace, it should have huge positive impact in terms of tourism. You are aware tourism employs at least 1.6 million Kenyans. And so we believe this is timely in terms of opening up the economy. Secondly, Nairobi is an investment hub, not just for East Africa, but the entire region. And so we shall have investors, we shall have business people now having to travel to Nairobi to be able to do their business. And of course, trade. You are aware, like Kenya Airways, although they don't have many freighters, planes which carry cargo, they do carry a lot of cargo in the passenger flights. In the belly of, for example, the 787 aircraft, they can carry up to 40 tons of fresh produce. So by opening up the airspace, we should see not just the passenger travel benefiting, but also in terms of cargo, which will bring more business and more employment to our country. We never stopped cargo flights, so what we are doing now is to augment what we've done before. And so we expect going forward, subject to certain conditions, subject to airlines following the protocols required, we expect to see a positive impact in terms of the economic development of our country. Thank you very much.
Thank you very much, Waziri. I think we will now allow the media to pause, and I would want to request kindly, because of time constraint, that we restrain ourselves to at least just 3 questions that are directed to the statement that CS Macharia has made or the one from the Ministry of Health. 3 questions, please. So.
Hi, my name is Graham Kajilo from The Standard. My question is on the issue of the 96 hours testing. You said that these people will not be put on quarantine. So does it mean if someone else comes out of that window, they'll have to be put on quarantine? And also, I would like a response on the recommendation that were made by the WHO in terms of improving the care and response of COVID-19.
My name is David Mudhoka from TV47. I have 2 questions. The first one regards one of the measures set to combat the spread of COVID-19, and that is masks. With the government now requiring almost every Kenyan to put on masks in public places, we have seen growth in varieties of masks, some of which the ability now to contain or rather to keep the virus at bay remains questionable. What is the ministry's comment on even masks made of cloth, made of cotton, made of sponge in combating COVID-19? Then the second question is about home-based care. How many people now do we have on home-based care? And how many people even are in our hospitals receiving treatment? And what is the condition? What is the state of our isolation centers?
Helen Aura from NTV. This is to the ministry. Do we have accountability as to how the COVID funds are being utilized, considering the fact that one top government official has raised an alarm on how to handle the matter and how the funds are being used? And are we slacking on contact tracing thus far? This 2 questions for the Ministry of Transport. We've reopened international travel, but right now we still see that the public transport sector within the country, they're blatantly disregarding the laws which are there. And we see the transport sector, the matatus are carrying passengers in excess. What are we doing about it? And you said for those arriving past curfew hours, you have to have a document showing that for you to be allowed in due past curfew. So is this going to be a special document issued by the government, or are you just going to show the during the roadblocks, will you just show your travel passes considering that you've come into the country? Kindly expound on that.
Okay, so there are 2 questions for you, Waziri. I think the first one and the last
Yes.
one, so I'll allow you to respond to that.
Okay, let me start with the first one, where I think the gentleman asked about if somebody takes the test before the 96 hours, what will happen when they get here? Will they be quarantined or not? I think the answer to that is that they'll not be allowed to travel in the first place. Because by the time you board, the requirement is very clear. You have to show the COVID-free certificate done through the PCR testing process. And whoever is allowing you to board must check when that test was done. If it was done before the 96 hours, then of course you'll not be allowed to board. And therefore, the question of quarantine here will not arise. Let me also answer the last one, which was asked about the public transport by NTV. Yes, obviously this is a matter of concern, and that's why we have asked the law enforcement agencies to do what they can to make sure that those breaking the law or breaking the requirements which have been put in place, they are put in the right place. So this is a matter which we are taking very seriously. I know in terms of the numbers which these buses are supposed to carry, it's very clear. We have engaged the stakeholders. They know what is required. For example, they know you have to have a certificate which is co-signed by the Ministry of Health, but also with the county commissioner himself. And so that certification has to continue. And during the checkups, during roadblocks, we shall be checking through the law enforcement agencies that indeed those public buses are not breaking the law. The issue about curfew, what document? I think we did say that they do not require a special document, whether you're flying out or flying in. If you're flying in or flying out, you must have either a ticket or a boarding pass. Nobody flies without any of those two. And so those two will suffice. We not require to get additional document to prove you're flying in or you're flying out. The boarding pass or the air ticket will suffice. Thank you.
Thank you, Waziri.
What needs to be improved to make sure that when we go for international flights, we shall be indeed very ready to do so. And so today I would like to read a communique specifically targeting the international flights. This communique is on the resumption of international air travel on 1st of August 2020. His Excellency the President of the Republic of Kenya directed that international air travel would resume on the 1st of August 2020 and instructed the Ministry of Transport, Infrastructure, Housing, Urban Development and Public Works to develop a protocol to ensure the safety of the travelers. I would like to report that this protocol was completed by a multi-agency team and duly approved ultimately by the CS of Health on the 14th of August, of July. The ministry, in consultation with relevant stakeholders, prepared a protocol for air travel operations during COVID-19 public health crisis. The protocol seeks to provide guidelines to ensure that air travel remains safe during the pandemic for both domestic and international flights. The protocol recognizes that the adverse impacts of the COVID-19 pandemic have been experienced in most sectors of the economy, and the aviation industry is amongst the most impacted. The protocol has therefore confirmed as follows. 1, all arriving passengers on international flights with a PCR-based COVID-19 negative certificate whose body temperature is not above 37.5 degrees Celsius and do not have a persistent cough, difficulty in breathing, or other flu-like symptoms and have been tested 96 hours before travel shall be exempt from quarantine. Let me say this is not a blanket approval, and so we do have initially a list of countries from which passengers will be allowed. This will be a list which will be reviewed on an ongoing basis, because you know this issue about COVID is not static. It gets better, it gets worse. So whereas we have an initial list here, by tomorrow we shall review that list, depending on circumstances on the ground when we do the global mapping of the threat and intensity of the coronavirus. But for a start, these countries which I'm going to mention here will be the initial list from which we shall be allowing passengers to come from. 1, China, South Korea, Japan, Canada, Zimbabwe, Ethiopia, Switzerland, Rwanda, Uganda, Namibia, and Morocco. These countries are the countries with mild or limited community transmission. All they have declining incidences. And these are the ones initially we shall be allowing passengers to come from. In terms of the protocol, number 2 of what we are going to highlight, for those passengers traveling out of the country, meaning you and me, they'll be required to abide by the particular travel, health, and COVID-19 related requirements of the destination country. So before you travel, make sure that you know where you're going, what that country expects. We also like to put some heavy responsibility on the airlines. Before you board your passengers, just like you check on the visa requirements, just make sure that your passengers comply with the requirements of where they are going. Number 3, passengers are arriving on flights after the curfew with a valid air ticket and boarding pass shall be allowed to proceed to their hotels or residences. Number 4, drivers of those passengers should have evidence that they came from the airport to drop or pick up passengers. Number 5, passengers departing on flights after curfew and with a valid air ticket and boarding pass shall be allowed to proceed to their destination or their departure airport. 6, air operators shall provide guidance material to passengers regarding application of the preventive measures on board. Number 7, where physical distancing cannot be guaranteed because of the seat configuration or other operational constraints, the crew members will make constant on-board announcements reminding passengers to adhere at all times to all the other preventive measures, including strict hand hygiene and respiratory etiquette, and should wear surgical face masks. In addition, and in such cases, other measures such as cabin recirculation, air filters will be in place. 8, and last, working jointly with Airports Authority and Kenya Civil Aviation, the Ministry of Transport, Infrastructure, Housing, Urban Development, and Public Works is reviewing frequency and timing of flights to facilitate physical distancing at the airport. You know, before COVID, some of the airlines used to have like 7 flights per week. Others up to actually 24, because they used to have like 3 flights per day. Now, as you know, there's COVID, and so there was an issue whether we should reduce this frequency of those flights. But what we know is that initially the numbers of people traveling will be quite low. So we shall be reviewing in the first week